Now, Doc.
Yes, sir.
Let's get back to cancer.
Okay.
I have some people that I know who have died, and it's really shaken me.
Yes.
That I know personally.
People we love, yes.
People we love are dying. And I read a report on Google News and CNN News on my iPhone. I like to look at that because it's so, it's so easier. And I read a report where now cancer is the #1 killer in America. And they're saying millions more will die the next few years with cancer.
Yes, sir.
Because they can't stop it, I guess. What's going on?
We can stop it.
Well, they're saying they can't, okay? That it's just gone beyond their control. You told me yesterday why it's killing people, but
Yes.
how do you reverse it?
Okay.
But just in case someone missed
Well, just
it,
briefly.
what's causing all this?
Okay, well, briefly, it's much easier, much more economical to prevent cancer than it is to treat it, okay?
Of course.
And so that's just true.
How do we prevent it?
Okay. You have to give up oils, all free radicals, trans fatty acids, heterocyclamines, acrylamide.
Stop all the oils.
Stop all the oils, even olive oil, even coconut oil. Got to get rid of it. Cook in butter, cook in margarine, bake in lard. If your religion doesn't mean you can't eat lard, right? But go to France. They live 10 years longer than we do.
Where?
France.
Okay.
They cook everything in lard. I mean, can you imagine a French croissant being cooked in margarine?
But, we heard that stuff is bad for your heart.
Who told us that?
You hear it all the time.
From doctors.
Clog arteries.
No.
Don't eat butter. No croissants. All that.
Absolutely wrong. Okay.
But how much butter? You can't eat a whole lot of it.
Eat a stick of butter a day. Just remember the Eskimos. They eat all this fat and red meat, and they have the fewest heart attacks of any culture.
Doc, you make me laugh.
Okay.
You're telling
That's
me
good.
the
Laughter is good
opposite of
medicine.
what I've heard all these years. Okay.
Well, that's why we're in
So
trouble.
stop all the oils.
Yes, sir.
Fried oils, all that
That's why the pastors are dying, because they give the most wonderful spiritual lecture in their church, and then they go downstairs with their church family and they eat fried chicken. Bam! They're dead.
Well, then how should you eat the chicken?
Baked, roasted, stewed, crock-potted, not fried.
No more fried chicken. Okay.
No, sir.
So everything fried must stop.
Everything fried must stop.
Okay. What else?
Okay. No oils. We already know that. And that means oils in
I'm not
places.
happy with you on this one because I love olive oil.
Okay. But
I'm listening.
Moths go into the flame too. Moths go into the flame too. So
Anyways, keep going down.
Okay.
What else?
Now, how do you reverse it? Now, one of the things we know.
But wait, is there anything else that we should know not to eat besides the oils and the fried foods?
And processed meats with nitrates, nitrites. Nitrates and nitrites like in deli slices and sandwich meats and sausage, ham, bacon.
And you also said frozen fruit desserts. Like it's a no-no.
Yeah, it's kind of like fake ice cream.
Frozen desserts will cause cancer.
Yes, sir. And clog your arteries and cause you to have Alzheimer's disease, all kinds of weird stuff.
Wow.
Okay. I actually sued the FDA in federal court and prevailed over a trace mineral called selenium to be able to make claims. And
you sued them?
Yes, sir.
And you won?
I've sued 8 times the FDA in federal court, and I prevailed 8 times.
Wow.
Now, on the selenium and cancer, I sued them to be able to have a claim for our product that says, by supplementation with 200 micrograms, 1/5 of a milligram of our selenium, you can actually reduce your risk of cancer. Okay, and I'll tell you the percentage in just a minute. And also, it will support your body's ability to make anti-cancerous substances like glutathione. And they didn't want to do that. They fought me in court, but the federal judge saw that I had enough research to back it, and the federal judge said, okay, Wallach wins. So I can now say these things legally on your program.
God bless him for that.
Now, just by the University of Arizona, I believe it was 1998, came out and said, this is a big study, 7-year study on, 1,300 men or something like that. They said, if you supplement with 200 micrograms of selenium, it'll reduce your risk of prostate cancer by 69%, colorectal cancer by 64%, and also lung cancer, either smoker or not, by 32%. Now, we asked Clemson University from Clemson, South Carolina, to do a study on 2 of our multiple vitamin products. One a liquid called Ultimate Classic, and they gave this Ultimate Classic to human cell cultures, normal cells, also are beyond tangerine. They gave that one to human natural normal cells. And no toxicity. It increased the lifespan and the health of the cells, so they doubled it, kind of like doubled what our recommendations were. It increased the cell's life longer and more health, and they doubled again. And they said, we can't find a toxicity level of your program. Then they took the same 2 products, and they gave it to human cell cultures that had colon cancer, liver and stomach cancer and breast cancer. Our one product, Ultimate Classic, killed 95% of the colon cancer cells in cell culture. The Beyond Tangerine killed 65%. When it came to liver cancer and stomach cancer, the Ultimate Classic killed 65%, and the Beyond Tangerine killed 32%. Breast cancer, both of them killed 32%.
These are things that you offer.
Yes, sir.
Minerals.
Oh, absolutely.
Supplements.
Yes,
all
yes.
that.
Yes, sir. Part of our, what we call our Healthy Start Pack, or
So that's how you've been able to reverse cancer in some people?
yes, of course, you have to appreciate that cancer is things that are going wrong in the cells. If you give the cells the right raw materials, the cells back off and say, you know, I've got all my raw materials here. I don't have to do all this bad stuff anymore. I'm not driven to do this bad stuff. And again, we use the information from Clemson University, University of Arizona, the Harvard Nurses Health Study. It was 20 years, 90,000 nurses. We learned so much for that. We employ all this information.
It's so sad they don't tell you this out there.
No, they don't tell you. But it's all in here.
Well, of course you do. But I mean, chemotherapy is killing people, or they treat them with all
Doctors
kinds
make
of...
$40,000 every time they give you chemotherapy.
What?
They make $40,000. But insurance pays, so who worries? But the chemotherapy kills more people than the cancer does.
All the time or sometimes?
Most of the time. Chemotherapy fails 97% of the time. That was in New England.
Now, sometimes chemotherapy will help.
Reduce the size of the tumor.
Well, it did with my father-in-law. Then the cancer came back and killed him because he was older. Pardon?
It didn't cure him. It just reduced the size of the cancer. Well, now here,
so that's all it does, basically.
Reduce the size of the cancer. It does that. But
and then you think they're okay.
Yeah. Now Nature magazine came out last year. Very well-respected scientific journal, Nature magazine. They came out and said 85% of all the cancer research published in medical and scientific journals is a lie. Nature magazine said 85% is a lie.
Oh.
Because the pharmaceutical company that did the research, the universities that did the research at the behest of the pharmaceutical company, left out all the bad stuff. They didn't say that, oh, well, it'll reduce the size of the cancer, but it also kills the patient. They didn't leave it. They didn't say that kills the patient part. They didn't tell the patient that when they said, here's an option for you. And so they said 85% of what is said about a new cancer treatment is published in journals is wrong. That was in Nature magazine 1 year ago. It's all a big lie.
So people have to take charge of their own health and future and not be dependent on what they are hearing.
That's correct.
From whoever.
Doctors. We have to put the finger where it's at, Pastor Benny.
I mean, it's scary when you hear all the young people dying with cancer today.
Yes.
It's like, why is this happening?
Well, how many young people take the 90 essential nutrients? Very few. This is where we as parents...
Yeah, but they don't know about it.
Well, that's our job. I'm so honored that you would help me share this information so that people can get it to their kids and grandkids. Back about 2008, cover story in Time magazine. Right on the cover it said, the next generation is going to be worse off than us. You get into the article, what it says is that our generation are going to be burying our children. We're going to be standing at a gravesite burying our children because we followed the doctor's advice for our children. It was wrong. We should have followed grandmother's advice, not the doctor's advice.
I mean, you sweet people ought to Google the information about cancer, because I just saw it, where cancer is increasing in America and the world. They're saying now it's the #1 killer. And in the next few years or something, there'll be like 7 million people dying.
In 10 years, 7 million people.
Per year or something.
Well, no, and right now it's 7 million people. In 10 years, it'll be 70 million.
Can you believe it? That 7 million a year are dying with cancer already? And it's going up. It's not going down.
That's because people are listening to